In September 2018, Public Health England issued a report confirming that Alzheimer's and dementia is now the leading cause of death in women, and by 2020 it's expected to be the leading cause of death in men as well. There are 50 million people worldwide living with Alzheimer's and dementia, and by 2030 that number is expected to rise to 75 million. We need to work together to build a world more capable of caring for and supporting people with dementia. There are three key problems we need to address in order to build a dementia-friendly society whilst also working towards prevention and possibly even one day cure. Clearly the most immediate problem that needs to be addressed is how can we make the person living with dementia's life better. The NHS recommends trying to maintain a normal life which can include an active social life, but leaving the house independently can become a scary proposition. So how can we ensure safety and security for the person living with dementia? The second problem is caring for the carer. In most cases, the next of kin, be it partner, spouse, or even son or daughter, becomes the carer. How can we help maintain a normal life and ensure that they feel secure that their loved one is protected when they're not with them? And finally, research. In the UK, dementia is the only condition within the top 10 causes of death that doesn't have a treatment or cure. The government puts less than a third of the money it spends on cancer research into research in dementia, but dementia costs the economy nearly £10 billion more. It's been just over 100 years since the first person was diagnosed with Alzheimer's, but over a century later, we still wouldn't be able to offer her a treatment to slow or stop the disease.
To solve these problems, we developed Safe Spaces. Safe Spaces is an app that allows people living with dementia to live better. So we've solved these problems one by one. First off, we're helping the person living with dementia to live an independent life. We're doing this by the app constantly telling them where registered safe spaces are. If they ever feel in trouble or in difficulty, they can swipe across one of these safe spaces and the app will automatically direct them to the nearest safe space where they can get assistance should it be needed. Problem two, we've given the carer peace of mind. Safe Spaces allows the carer to have their own login and to understand in real time where their loved one is at any point in time. It allows them to understand when they've activated the Safe Spaces app to get into a safe space by pushing colour-coded notifications to the front screen, and also to be able to allow them to automatically know if they're ever within 10 metres of a hospital or a police station and automatically push a red notification to their home screen so they immediately understand when and where their loved one is. And thirdly, research. 100 years have passed and we still haven't moved any further forward in our understanding of what causes dementia, how to treat it, or how to cure it. Our app is going to go some way towards collecting a much better data set. Every day we'll ask the carer to essentially ask a few questions of observations of how their loved one is progressing. We'll use that information in combination with the information of how and where they've been, what the weather was like, what the traffic was like, what the conditions in the environment they were in was like. And we'll collect all this data and turn it into a unique data set that will help to further and better understand exactly what goes towards an individual's suffering with dementia. Long term, the dream is to help to find a cure to dementia. But mid-term, we want to take all the data that we're generating from Safe Spaces app and create AI-driven models that understand and help to give every single person living with dementia a customized health plan. But most importantly today, Safe Spaces is helping people living with dementia
live better.